if we were going to use this combination, as you said with the last patient, Vivian, you would start with 16 units if you're going to use ideglira. You would start at 30 units if you're going to use iglar-lixi because he is above 30 units. Even if he were on as much as 50 units, you would want to still go back on iglar-lixi to 30 units and titrate back up. But as you said here, one might have some flexibility to pick a reasonable dose and go ahead and switch the patient over. Now, if you switch this patient from liraglutide to lixisenatide, which is a shorter acting GLP-1 and may be associated with a little higher rate of nausea, I might caution not to do that unless you go back down to the 30 units and then titrate up from them. That would give you the starting dose of lixisenatide being 10 micrograms. But again, when you titrate, you're going to titrate just like you do basal insulin. And these studies were all done differently, but we all, as you said, Vivian, have self-titration algorithms we like to give our patients. I like to have them written down for them. I like to have the patient repeat it back to me before they leave the office. And I always like for them to check in either by phone or if you use email or something like that, sort of 2 to 3 weeks in, make sure that they are continuing to titrate and that they're not running into any problems.